Cua, and this is Mugshots Now, a modern digital Filipino media platform. Watch life from a new perspective, bringing a new flavor of fun, a new revolution of entertainment, giving you our best shot. Ask the expert. Health is a state of body, wellness is a state of being by Jay Stanford. Mga ka-mugshots, welcome to MugPahaba ng Buhay every Tuesday at 6 p.m. Ang episode natin ngayon ay tungkol sa pag-exercise ngayong pandemic. Ang makakasama natin ngayon ay si Dr. Constantino. Siya ay isang Sports Rehabilitation Medicine Specialist. Hi, Dr.
Hello, Emy. Kumusta?
Okay naman.
Thank you sa pag-invite sa akin ngayon, no? So, Dr. Emy nga mentioned, no, na topic natin today is fitness and exercise. That has been a concern ngayong lockdown, no? Kasi ang daming tao na nahirapan either to start being fit or to continue whatever fitness regimen they started before the lockdown, no? Siyempre, hindi na tayo ganun kadalas mag-gym kasi minsan nakakatakot, no? Dahil usually closed circulation, pwede mag-circulate yung virus. And then, of course, work from home. So, medyo nagiging sedentary tayo. But again, no, fitness is a commitment, no? So, minsan, makikita natin sa social media, yung mga vloggers, sa Facebook or YouTube, nagpo-post ng maraming fitness ideas at home, no? They make it seem so easy. So, sometimes yung tendency, instead of being motivated, no, we sometimes get discouraged kasi naisip natin, ang simple lang pala, ba't hindi natin magawa? So, what I want you to realize is mahirap talaga, no, maging fit ngayong pandemic. So, don't be discouraged. And if you want to be fit or stay fit and some of your methods aren't working, no, just don't get disheartened, no. Just keep on trying new things kasi fitness is something you need to do every day, no. It's something that you need to practice, no. Hindi siya yung kunyari, 2 weeks lang ako mag-exercise, 2 weeks lang magda-diet. Hindi ganun eh. It usually won't work like that. So don't get discouraged if what you're doing right now isn't working. Just keep on trying new things until you find the right thing, no, to help you in your fitness journey. So yun lang, no, for
Thanks, Dr. Ang dami nating questions from our netizens kasi ang hirap maghanap ng motivation to exercise ngayon at home. And I see a lot of people, kahit ako, nagtatabaan talaga. So, how often ba should a person exercise, Dr.?
Okay, so for exercise actually, we can exercise every day, no? But, of course, may mga caveat dun, no? If we're doing strengthening exercises, no, we can exercise every day as long as we're not targeting the same muscle group. So, kunyari, nagba-bicep curl ka, no? Don't do your bicep curls every day. So, kunyari, MWF, mag-bicep curls ka, and then for TTHS, dun ka mag-leg day, ganun. Because muscles need to rest and recover, no? That's how they develop, no? If you work on the same muscle groups every day, they actually won't develop and you can put them at risk for injury. And then for other exercises, like exercises for flexibility, balance, mobilization, no, yung mga stretching natin, ganon, yung mga pilates, yoga, yun, pwedeng everyday din yun. Kasi we're stretching, di naman tayo nagpapalakas ng muscles.
Yeah, so di ba ngayon parang before meron tayong mga light exercises, moderate exercises, and parang mga heavy exercises. So parang how often mo ba, parang ano ba yung tamang halo ng exercise na gawin at home ngayon?
So it actually depends on you, no? So one of the things is about fitness is you have to first identify your goals, no? Kasi merong iba-iba yan, no? So kunyari, nabanggit mo nga yung mild exercise, moderate exercise, high intensity, no? Yung sa other than moderate. So for example, your goal is to lose weight, no? Actually, it's been tinuro sa amin, no, in residency training, no? If you want to lose weight, you do more of yung mga moderate exercise na around ang optimal is at least 30 minutes every day, or kung hindi kaya, every other day, no? For moderate exercise, that entails kunyari brisk walking, stationary bike na hindi intense masyado, no? And then for example, ikaw naman for example, kunyari before the pandemic you were an athlete and then you want to maintain your physical fitness, no? Your high endurance, kunyari marathon runner ka. dun kan siguro sa mga high intensity na yung mga for cardiovascular endurance exercises. So it really depends on your fitness goals, on what kind of exercise to do, and the intensity as well.
Well, kunwari ngayon, di ba, hindi ka makapag-jogging, tapos wala ka namang treadmill at home. Ano ba yung mga alternative exercises that you can do?
So for for jogging, kasi jogging kasi is it's a cardiovascular exercise. So actually one of the things I advise to my patients who want to continue exercising, ang pwede nilang gawin yung stair climbing actually, kasi it also stimulates yung endurance mo, no? And then kasi may mga studies na nagsabi na na magbuhat ka lang ng weight, siguro mga 5 pounds, 10 pounds, and then just climb up and down the stairs. Yung mga studies na nagsabi that the amount of calories you burn per minute is the same as jogging. Ngayon, kung sabihin natin wala kayong stairs sa bahay, what you can do is actually burpees, ganyan. Basta just do something regularly, na mapapagod ka. Na yung exercise kasi pagka nagpe-prescribe kami ng exercises, meron kaming frequency, yung mode of exercise, tsaka yung mga precautions. So yung mode of exercise, yun yung sinasabi ko anong klaseng exercise gagawin mo. So if you want to do something similar to jogging, syempre hindi yan yung parang yung mga heavy weights, tapos yung mga burpees, yung mga planking, yung mga mountain climbers, so something that would stimulate your endurance that you can do inside the house. Tapos yun nga, siguro one of the things to get by, to overcome yung problem natin of medyo nakakatamad or nakakasawa at home, mix and match your exercises, So maganda ngayon where YouTube and the other social media sites are at our disposal, So marami tayo nakuhang ideas. And then kung kunyari may makita tayong medyo kakaibang exercises sa social media tapos hindi tayo sigurado, so it's still best to consult your physician, kasi baka mamaya sobra-sobra yung gagawin yung exercises tapos hindi na pala healthy. So yun lang naman yung pwede doon.
Okay, like di ba ngayon, since nagtatabaan yung mga tao, most people nagkakabilbil. So ano po yung advice mo to reduce yung mga belly fat?
So mga belly fat or love handles, So actually, ang best thing dyan is yung you reduce your caloric intake, You create a caloric deficit. Kasi ganito, So lahat tayo, we have what we call the resting metabolic rate, So kahit wala tayong ginagawa, actually our bodies are burning calories, So actually, majority of what we eat or consume during the day are burned through the resting metabolic rate. So in order for us to successfully lose weight, we have to make a caloric deficit. So ibig sabihin lang nun na what we consume during the day should be less than what we burn. So para pumayat. So marami kasi nag-iisip na kunyari gusto ko maka-lose ng belly fat or love handles, we should do abdominal exercises or core exercises. So hindi totoo yun, Because hindi porket sa abdomen ka nag-exercise, liliit yung tiyan mo or yung bilbil mo. You really have to make a caloric deficit. And I did not want to use the term diet, Kasi nga ayoko nung ganun yung magda-diet ka lang for 2 weeks para pumayat ka. What I want is, you find, you can still eat what you want to eat, Bawasan nyo lang yung portions, Kasi nga sabi ko nga, it's a commitment and the lifestyle. So, yun nga, hanap ka ng way para kumonti yung food intake mo para makakreate ka ng caloric deficit, So marami ring apps, yung mga MyFitnessPal, ganyan, para natatrack mo yung intake mo tsaka yung binaburn mong calories. And then yun nga, as long as you maintain, you maintain a lifestyle wherein you always have a caloric deficit every day, that's the best way to lose weight. And then of course, if you augment it with exercise, mas maganda yun, So yun.
Di ba ngayon sobrang daming work from home, so sobrang sedentary ng lifestyle. So what do you advise na parang yung minimum exercises na gawin nila, kasi syempre nangyayari all day nasa online meeting. So ano yung mga ma-advise mong mga exercises that they can do kahit kumbaga naubos na yung time nila mag-online meeting?
Okay. So actually, no, being sedentary is actually a problem, no, even before the pandemic. Kasi recent studies have shown that yun nga, prolonged sitting the whole day actually puts you at risk for heart disease and stroke, the same as smoking. Kaya nga sinasabi sa aming mga rehab ngayon, no, sitting is the new smoking. Kasi if you do prolonged sitting for majority of the day, hindi nga siya maganda. So, number one, no, what I advise patients is, of course, hindi mo naman you can't help it, no, sa work mo if you need to sit down. The thing is, you have to break that prolonged sitting. So, basta as long you should have intervals of kunyari every 30 minutes, every 15 minutes. Make sure to stand up, just walk around your room or your office space, and then sit down again. So just be creative. No? Meron akong patient dati na comic book artist. No? So sometimes sabi niya, pag talagang toxic yung deadlines, minsan 23 hours siya tuloy-tuloy nagdo-drawing. So what he did, no, after he consulted, ang naisip niyang gawin, no, meron siyang pitchel ng tubig sa tabi niya. So inom siya ng tubig. So every so often, napipilitan siyang pumunta sa CR para mag-urinate. So yun, nabe-break niya yung cycle of sitting down the whole day. And then of course, exercise actually, no? Regular exercise has been shown to reduce the bad effects of prolonged sitting. Parang paninigarilyo, no? So sabi nila, if you quit for a certain amount of time, yung life expectancy mo bumabalik. So ganun din with sitting, no? If you do regular exercise, yung bad effects ng prolonged sitting mo will manenegate siya. So siguro if your problem is actually time, no, because of your work, you have just a minimum amount of time. Siguro that's another indication for yung mga high intensity exercises, no, because of course with high intensity exercises you burn more calories with a shorter amount of time. But of course you should always start slow, no? For example, sedentary ka tapos you want to start these high intensity exercises. Don't start them right away, no? Magpa-condition ka muna. So you always start small, no? You always start slow. And then over time you build up. So yung high intensity exercises, those would be your goal, no? So you always start small. So kunyari mag simple as konting sit-ups ka lang muna, push-ups ganyan, and then as they become easier, that's the time you progress your exercises, no? So yun lang.
Doc, like, di ba kayo sinabi niyo parang dapat may rest, may exercise. So do you recommend na talagang 5 times a week or 7 times a week yung exercise?
Yes, pwede naman, no? Sabi ko nga, no, as long as you're not targeting the same muscle groups, no? So, yun, you can exercise every day. Like what I said, for example, you do you exercise your arms or your core, no? Every Monday, Wednesday, Friday, and then you can do your leg day, TTHS, no? Yung mga endurance exercises like brisk walking, walking up and down the stairs, pwede rin yun for every day, no? Kasi your goal there is for your endurance or your increased stamina. Yung mga hindi talaga advisable gawin every day for strengthening. If you want to build muscle, if you want to build your strength, exercises that you do for those goals, you shouldn't do every day.
Yeah, so ngayon sobrang uso yung mga selling of home gym equipment. So I can see that everywhere may mga Facebook pages, may mga Shopee, may mga Lazada. So sobrang daming equipment out there. Ano ba yung marirecommend mo na siguro kunyari for starting 1 to 3 equipments? So yung marirecommend mo for starting, tsaka yung mga may limited budget and also yung mga unlimited budget.
All right. So yeah, tama ka, no? Since the pandemic started, ang dami ko nakikitang ads, no, sa Facebook na mga gym equipment, no. So siguro to answer your one of your questions, so if you're on a limited budget, no, know your goals again, no. It's always important to start with your goals, no? What you want to achieve. For example, you want to build your arms, no, your arm strength. Of course, you can invest in dumbbells, no. And then siguro it's best if what you invest on are the yung dumbbells na removable, yung natatanggal yung mga weights, so you can increase weight. So in the future, if you get strong enough and then the dumbbells you have at home are very easy for you, you can increase your weights, no? So plates na lang bibilin mo instead of new dumbbells. And then for example, you want to work on your core, siguro one of the best equipment are kettlebells, no? Because you can do several core exercises with just one kettlebell or a pair of kettlebells, no? And then yung ano maganda rin actually, no? If you want to increase your core strength then, no? And if you want to target several muscles at the same time, yung mga pull-up bar, because our body, no, in our in human anatomy, there are several muscles in our back and our trunk, no. Ang daming muscles yan. So if you do pull-ups actually, yung wide arm pull-ups, ang dami yung muscle groups na ma-identify diyan. No? Ay sorry, ma-activate. And then of course, kung syempre kung wala kang budget restrictions, ang daming home gym ngayon na nag-offer yung mga complete na talaga, yung mga multi consideration mo lang yung space sa bahay mo.
Okay. So yung next question natin is, I've been exercising na kunyari for 2 weeks, tapos parang hindi ko naman na-feel na may benefit or losing weight. What do you advise should I do? Anyway, we'll be right back after the break, then we will answer that question. Welcome again to MugPahaba ng Buhay. Ako si Doc Emy and ang guest natin today is Dr. Christopher Constantino. Siya ay isang Sports Rehabilitation Medicine Specialist. So before tayo nag-break, we had a question hanging. Ang question natin was, I have been exercising for 2 weeks and I don't see any benefit. Why is that kaya? And what should I do?
Actually kasi, no, yan ang challenge namin bilang rehab, no. Most of our therapeutic inventions are based on exercises or strengthening interventions, no. So actually kasi, no, exercise really takes time, no, before you feel the effects, no. Be it, trying to increase your endurance, trying to lose weight, trying to get muscle hypertrophy or bigger muscles, no. So for example, for muscles, no, it takes around 2 to 3 months before you see any notable or notable changes on your muscles. So ganun din sa endurance and weight loss. So 2 weeks is definitely not enough, no, to see the effects of your exercise. Kaya nga I've been saying this several times now, no. It's really a commitment, no. So yeah, you haven't seen any benefits, 2 weeks ka na nag-exercise. Just continue what you're doing, no. That's why it's very important to find something you really love, no, or something routine you're comfortable doing so that you can maintain it, and then eventually ganun siya magugulat ka na lang nandun na yung goals mo, pero it really takes time.
Yeah, starting ng pandemic, I've been talking to a lot of moms na really worried about their kids kasi syempre online school na, walang PE classes. So they're really worried about their kids because their kids cannot go out. So what exercises kaya can their kids do at home?
So for children, no, there's a specific guidelines for children, no. Kasi 'di ba meron ding myth na pagbata bawal mag-exercise kasi baka hindi tumangkad, no. So that's really not true, no. So for children, no, the guidelines for strength training, kunyari gusto mo mag-strength training yung anak mo, no. So around 3 to 4 days a week is enough, no. But if you want to do it daily, pwede naman, no. And then the recommended intensity is actually moderate lang, no. Moderate physical activity. That of course, no, nasa bahay lang tayo, no, wala tayo sa mga PT gym or anything. Para masabi yung moderate, no, it's physical activity with noticeable increases in breathing, sweating, and heart rate, no. So pag ganun, okay na yun. Wag susobra, no? Pagka pagod na hapong-hapo na yung bata, that would probably mean he or she is doing high intensity exercises na. And then siguro 30 minutes a day of moderate or vigorous intensity, no? Tapos pwede ring accumulated of 60 minutes in a day. So kunyari gusto ng anak nyo twice a day, more than once mag-exercise. So cumulative, pwede na yung 1 hour total during the day. Tapos yung mode or type of exercises, no, a variety of activities that are very enjoyable to your child, no. So ang mga ano lang, mga iingatan lang no kasi with children no, their thermoregulation or the way their bodies regulate heat no, it's not the same as adults no. So yung mga iingatan lang sa mga bata no, yung mga wag mag-exercise sa masyadong mainit na lugar or panahon. So kunyari iwasan yung mag-exercise sila pagtanghali no, during noon. And of course, you should keep them well hydrated nga kasi nga hindi pa mature yung thermoregulation nung ano nila, nung katawan nila.
Okay. So, yung next question ko is, di ba sa PE classes kung bata tayo para kailangan PE sa umaga or a certain time kasi para daw sa vitamin D, ganun. So, how much sun exposure ba talaga should we get to get enough vitamin D? And my best time ba kung kailan dapat tayo magpa-sun exposure?
Well, actually, no, buti na banggit mo yan, no? It's one of the things I always explain to my patients, no? Especially may patient with osteoporosis or osteopenia who require vitamin D. So actually, vitamin D is activated in the kidneys by UV light, no? That's why we advise patients to get early morning sunlight, no, when they're taking vitamin D. Kasi if you keep on taking vitamin D, but you're not getting adequate sunlight, the vitamin D, most of them won't get activated inside your body. So, actually, ang advice namin ngayon, siguro, anytime between 5 to 7 a.m. Kasi nga, usually 7 a.m. onwards, masyado nang mainit, no? So, that's not good for your skin. Magalit yung mga derma friends natin yan. So, siguro, kahit 15 minutes a day is enough, no? So, maganda na, kunyari, you do brisk walking, just do it early, no? Do it like 5 a.m., 6 a.m. and that would be good, no? For vitamin D activation in your body.
Yeah, so for this pandemic, I've known a lot of people who are pregnant. So I was just wondering kung are pregnant women allowed to exercise? Kasi diba sabi baka mamaya manganak bigla dahil nag-exercise. Diba dati parang usong-uso yung mga bed rest. Pero diba ngayon hindi na siya advisable talaga. So anong iba exercise do you recommend for the pregnant women?
Okay. So, to answer your question, generally, exercise is actually allowed and is actually encouraged during pregnancy. But, of course, again, I always say, exercise should be tailor-fit for all individuals. So, number one, that we should realize is that not all pregnancies are the same. No? So, there are certain pregnancies na medyo maselan, no? That's why there are certain females that are advised bed rest during the initial part of their or most parts of their pregnancy. So not everyone can safely exercise, no. But in general, if you're having a normal pregnancy, it's actually encouraged, no. What you have to realize though during pregnancy is there are a lot of changes in your body, and the developing fetus is actually competing with the mother in terms of caloric intake, no. So that's one thing, no. Ang sinasabi nila, you should actually increase your normal diet to you add 300 kilocalories, no, to your normal diet when you're pregnant and you plan to exercise, no. And then exercise actually reduces the risk for developing certain conditions associated with pregnancy, like pregnancy-induced hypertension or gestational diabetes, no. So that's why it's good. However, if I'm not going to say here, yung mga specifics on exercise kasi, I always advise patients to consult with their OB/GYN and rehabilitation medicine physician before engaging in any form of exercise, because we need to first you need to get clearance from your OB that you're not one of those females that need complete bed rest kasi baka maselan pala yung pregnancy mo. And then after getting clearance from your OB, kami namang mga rehab, we give you specific exercises because sometimes there are certain exercises na bawal at a specific trimester. So, for example, women should avoid exercising in the supine or yung nakahiga na position after the first trimester because such a position na nakahiga is associated with decreased cardiac output or decreased blood coming out from the heart in most pregnant women, no? So, kasi most yung mga cardiac output preferably is distributed away from the organs including the fetus. So if you're going to exercise in supine and then so in general yung cardiac output maintain ng body for the mother. So if you're going to put the fetus if you're going to exercise in a supine position, nababawasan pa lalo yung yung blood supply ng fetus. So that could be harmful for the fetus, no? So that's just an example of a certain precaution, no, that we advise certain pregnant women. So to summarize my answer to your question, no, exercise is generally safe and advised for pregnant women, but you have to seek clearance from your OB and seek advice from your rehabilitation medicine physicians first before engaging in any form of exercise while you're pregnant.
So aside from that, paano yung mga ibang sakit? Like yung mga may diabetes, may high blood? Kasi sometimes, di ba, parang natatakot sila mag-exercise kasi daw baka mahimatay sila, ganun. So what do you advise these patients?
So again, no, it's best if they could seek at least one consultation with us, no, sa rehab, so that we could educate them on their precautions. And then kahit na sabi mo, diabetic yung patient, we would still like to know their goals for exercise so we can tailor fit any exercise program. Pero to be in general, no, diabetic patients, especially those on insulin, have certain precautions when it comes to exercise. So number one, for example, people with diabetes should eat a meal, no, at least 30 minutes before exercise. So just a small meal, no, to prevent hypoglycemia or yung effects ng low sugar sa body. And then another general precaution for people with diabetes, no, you shouldn't exercise during your expected peak insulin activity. So when you're diabetic, alam yan, your endocrinologist will definitely explain that to you. And then for example, for hypertension naman, no, general precaution is you avoid exercises that would increase your blood pressure, like yung Valsalva or straining, umiire. No, so we actually have specific precautions or advice for patients who have hypertension para they can exercise safely, no, without conferring those additional risks for their comorbidity or other problems.
Yeah, thank you so much, Dr. I really learned a lot, and I'm sure our netizens learned a lot today. And actually, marami silang questions, and we will answer them all when we come back after.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face Body Laser Center, Andy Passion Eyebrow Embroidery,
We're back again here at MugPahaba ng Buhay. I'm Doc Emy Cua, and today our guest is Dr. Christopher Constantino, and we're discussing about how to stay fit during this pandemic. So ngayon marami tayong netizen questions, Dr. And ang first question natin ay from Lara of Ilocos. Kapag senior ba, pwede pa rin po ba mag-exercise?
Right, good question, no? Kasi most of our senior loved ones nasa bahay lang ngayon kasi bawal lumabas, no? So actually there are also guidelines, no, for exercise for seniors, no? So ano rin yan, no? We also prescribe that, no? So generally, no, you can perform na one set of 8 to 10 exercises that train all muscle groups. Tapos light lang, no? Wag masyadong intense or kasi syempre seniors have less bone mineralization than when they were younger, so they can safely do resistance exercises that target most muscle groups, as long as it's not that intense and they're comfortable doing so. And then the sessions can last siguro kahit maximum na yung 60 minutes, no, parang sa bata, no. You can do like 2 sessions of 20 to 30 minutes per day for an accumulated of 1 hour. Wag na sobra doon kasi baka naman na sobra na. Hindi rin maganda if it's too much for the.
Okay, so yung next question natin is from Edric of Bacolod. Para saan po, Doc, ang warm and cold compress?
Right, so warm and cold compress, no, it's a modality used usually for exercise and for injuries, no. So of course, ang cold compress, no, we actually use that, no, in the acute phase of injury. Sabing acute yung yung nangyari, ngayon pa lang nangyari. So kunyari na-injure yung tao, no, for the first 3 days, we use ice compress or cold compress, no. That's to to promote vasoconstriction or yung pagliit ng blood vessels para yung blood flow sa loob ng injured structure bumaba, para yung mga chemicals na nagpo-produce ng inflammation during injury ma-lessen. And then after 3 days, no, that's when we shift to warm compress para yung mga naipon dun na inflammatory products ma-wash out kasi we're now promoting vasodilation or paglaki ng blood vessels. And then warm compress is actually also generally used for pain relief. Pero ingat lang kayo, no, kasi sometimes pwede kayo magka-burns actually kapag nasobrahan yung warm compress. So ingat lang din, no, when using warm compress.
So yung next question natin, Dr. Frey, is from Totoy of Davao. Ang question niya, Doc, kapag nag-over-exercise ako at sobrang sumakit po yung paa ko o yung kamay ko, ilang days of rest ang kailangan kong gawin bago mag-exercise ulit?
Actually, to be honest, you can continue exercising, no? You don't need to stop exercising kapag na-injure ka, no? Kunyari sumakit kamay mo and you want to stay fit, edi do exercises that work your legs, your feet. And then conversely, if you injure your feet, you can do exercises that exercise your upper body or your hands, no? So kunyari you're an athlete, no, you're a volleyball player kunyari, and then you're training at home, na-injure yung shoulder mo. Siyempre sayang yung tuloy-tuloy ka nang nagiging fit, no, dahil dun sa exercises mo. So I mean, you continue exercising, you can work on your core, you can work on your endurance, no. So if you injure a certain body part and you can actually continue exercising, just do not do any exercise that would cause pain to the injured area. Yun lang. That's the very simple guideline. And of course, kung talagang malala yung injury mo, of course it would help to see a doctor.
Okay, thank you so much, Dr. for your time today. And I hope talagang marami natutunan yung netizens natin. Do you have any last words?
So actually, just this pandemic has taken a toll on everyone, hindi lang yung physical at yung mental, no? So yeah, just hang in there, no? And again, I just like to repeat what I said during the introduction, no? So being fit actually is really challenging, no? Don't let what we see on social media or any other platform na people who make it look easy, no? Don't be disheartened when you see videos like that, no? Take it as, just use them, no, to your own advantage. Kasi mahirap talaga, and being fit is a commitment, no? So don't be afraid to try things and fail until you find the best exercise or diet routine that you can stick to. So that's the secret to fitness, no? Something you can stick to that you can do on a regular basis for a very long time, or best if you can do it forever. So yun lang naman. Thank you so much, Doc Emy, for having me, and I hope natuto kayo, and stay safe always.
Thank you.
Thank you.
As the expert, health is a state of body, wellness is a state of being by Jay Stanford. Thank you mga ka-mugshots, and see you every Tuesday at 6 p.m. Ako si Doc Emy Cua, dito lang sa Mugshots Now. Magpahaba ng buhay. Keep safe and God bless everyone.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face, Body, Laser Center, Passion, Eyebrow Embroidery,